London has witnessed massive chaos on Saturday after clashes broke out between police and protesters at an anti-vaccine demonstration near Prime Minister Boris Johnson's residence in Downing Street. London witnessed massive chaos on Saturday, and crowds assembled in Parliament Square to protest against vaccine passports and other virus rules. This came amid reports that further measures could be on the way. Police and demonstrators faced off at Parliament Square and then later outside Boris Johnson's Downing Street residence. Now, the clashes came as Omicron was confirmed as the dominant variant in London, prompting the city's mayor to declare it a major incident.
We're incredibly concerned by the huge surge in the Omicron variant. Over the last 24 hours, we've had the largest number of new cases since this pandemic began, more than 26,000. Hospital admissions are going up, but also staff absences are going up by a massive level. So I've taken the decision, in consultation with our partners, to declare a major incident today.
The UK, meanwhile, has reported 7 deaths linked to the Omicron variant. According to media reports, draft regulations are being prepared, which might bring in new measures, like a ban on meeting others than for work purposes and limited outdoor service hours. Now, joining us for more on this broadcast is Dr. Julian Tang, a clinical virologist from the University of Leicester in the UK, to brief us about the Omicron conditions in the UK. Thank you for being with us, Doctor. Now, does the scientific data suggest that the UK needs more stringent restrictions now, especially during the holiday season?
Hello, yes. Well, ideally that would be the case, but as you saw from a previous clip, there's a lot of protests against this and the compliance may be very low. Christmas, New Year is always a risk, as we saw last year with the Alpha variant, and this Omicron variant with the ongoing Delta variant that we're seeing may lead to a spike in cases despite the booster program.
Right. Now, how does one differentiate between Omicron and the common flu, especially during the winter season? Because as we know, the symptoms for the two are very similar. And for common people, it could be tricky to tell one from the other.
You can't tell. Even the doctors, GPs cannot tell. Every season we have a lot of respiratory viruses, RSV, paraflu, adeno, influenza. This season we add Delta and Omicron to the mix because, of course, Delta can also present like flu. You may not have any of the other odd symptoms that you see with COVID with Delta. So you can't tell. You have to be tested. So that's why they say that anyone with symptoms or flu-like illness should be tested, and those with contacts to those who have flu-like symptoms should also be tested just to make sure it's not COVID. We're actually not seeing much flu at the moment or RSV, so probably most of the symptomatic cases at the moment are probably COVID-related, either Delta or Omicron.
Right, and after the Delta wave, it is an Omicron wave that has now hit the United Kingdom. Increasing cases are adding to the already burdened National Health Service. Are the stricter restrictions the only way to stop this wave? Or talk to us about the booster doses. Is this the way to go?
Yeah, the booster doses are still catching up. And we know that the difference between having 2 doses of vaccine and 2 doses of vaccine plus boosters is quite a big difference for Omicron. I don't think the booster program is going to keep up with this. I think we're going to see some spikes. Despite that, if you don't have increased social distancing, masking, and even work from home mandates, I suspect that this is too late now because the social mixing up till now has probably seeded Omicron into multiple households. So you still see a spread of the virus, even with those measures now imposed. And if they wait till after Christmas, I think the Omicron will spread a lot more over the next 10 days or so.
Right, and Doctor, what does the latest data suggest? Is the Omicron variant less severe than the Delta variant? Can we be sure?
So the conflicting views and data on this, the South African data suggests it is less severe clinically. The UK data, the modelling data just coming out of Imperial suggests that is no less severe than Delta, but those are very small numbers at the moment. So we're going to see those data starting to roll in over Christmas, New Year. But I mean, both sets of research teams do acknowledge that most of the hospitalizations are in the unvaccinated, both from Delta and Omicron.
Right, we'll leave it there. Dr. Julian Tang, thank you very much for joining us on this broadcast.
WION, now available in your country. Download the app now. Get all the news on the move.